faced since the Second World War, if not the most difficult year. We know now, with the latest data that's been released, that the challenge of lockdowns, the challenge of loss of employment or uncertainty or fears about health has all contributed to an increase in mental health presentations across the country and an increase in people seeking support through our different organisations such as Beyond Blue, Kids Helpline, Lifeline, Headspace. In particular, what we've seen in just the last 4 weeks, on the latest data provided to me by the Department of Health, is there's been a 31% increase in Medicare mental health services in Victoria compared to the same time last year. So one state, 1 4-week period, during the most difficult of times. I know, having been in Victoria, representing an electorate in Victoria, with family and friends and numerous constituents and people from across the state, that this pressure is real and significant. So that 31% increase, that compares with a national total of 15% or across the rest of the country, when you take out Victoria, so as the reference case, a 9% increase. And that's still a difficult time. So many people have economic uncertainty, and because of that, there are stresses, strains, anxieties, and in many cases, sadly, depression, which have come from it. With regards to the helplines, for example, if we compare Victoria with the rest of the country, then what we see is that for the 4 weeks to the 4th of October, Victoria's use of helplines was significantly higher than that for the rest of the country. Beyond Blue shows that there's a 77% higher per capita use in Victoria compared with the rest of the country. Lifeline is 16% higher than the rest of the country over that comparable period, and Kids Helpline 24% higher than the rest of the country. So against that background, what I want to emphasise is the support that is available. And I am pleased to be able to announce that the budget measure of the doubling of better access services is now in place already around the country. So it's available to people around Australia. And I think that's a very important step forward. And I would urge those that need to access the additional psychological services to work with your GP, to consult your doctor. I'd also note that the front line for anybody seeking mental health services is, of course, the GP. And coupled with the better access support services, this is a really significant pathway. Then, of course, there is the telephone, and the Beyond Blue National Coronavirus Hotline is a very important number for Australians. 1800 512 348, 1800 512 348. And then online, there are 2 very important but complementary resources. headtohealth.gov.au, headtohealth.gov.au, that's the national resource. And that national resource is about giving people access to any of the different channels. It may be in relation to eating disorders, where very sadly we've seen significant increases in the number of people presenting. It may be in relation to anxiety or depression or youth or Indigenous needs. And headtohealth.gov.au can help you find, even in the dark of the night at 3 a.m, a pathway to help. And then there is headtohelp.org.au for Victorians, and this is about helping you access the 15 new mental health centres that have been set up during the course of the pandemic, and they're specifically to help Victorians in this most difficult of times. On top of that, I would just provide a brief national report. We know that globally there are now over 38 million cases, that we've seen the highest days in terms of officially recorded numbers in the last week. 4 of the highest days have occurred in the last 4 weeks. In fact, the 4 highest days have occurred over the last week. There's now over 1,084,000 lives officially lost, and inevitably a far higher real number. And in Australian cases, 27,000 337 cases and tragically 904 lives lost. Across the country, there are 28 people in hospital, 1 in ICU, and I'm delighted to be able to say none on ventilation. There are no Australians on ventilation. We prepared with 7,500 ventilators, and that's an immensely important national achievement. We're not out of the woods. There's still a lot of work to do, but the fact that no Australian is on ventilation on the official advice of the National Incident Centre before joining you is, I think, a huge achievement. In terms of our testing, 8.1 million cases, including 39,000 in the last 24 hours, but we'd still urge Australians to be tested. Tracing, the system is strong around the country. It continues to improve in Victoria, but they have acknowledged that they are going through continuous improvements with some additional work to be done, but I want to acknowledge what has been done. I think it's very important to acknowledge those improvements. And then in terms of the distancing, we see in New South Wales what's been able to be done with cautious, careful, step-down distancing rules whilst maintaining a rolling average of under 10 cases a day in terms of the community. And so they've done that very well, and that provides a model for many.